Welcome everyone to another wonderful episode here at Jaws Podiatry. We're performing a MIFAS case, a minimally invasive case today. For a patient, I want everyone to look right about here. It's hard to see it because he's done such a wonderful job keeping the interdigital, right, in between, the interdigital callus at bay. The patient has a really pronounced bone spur right here on the fifth toe, which is actually the culprit of the problem. As everyone can probably also notice here, let me get a good picture there. Let me focus there for everyone. He used to have a lot of maceration, devitalized tissue forming right in between, and that was causing a lot of discomfort, number one. Number two, he probably also had an underlying fungal infection, which was already has been already eradicated. And then, you know, the goal of today's procedures is going to be very simple. What we're trying to do is we're going to go ahead and shave that bone spur down. Okay, and which is at the core of the problem, the bone spur, the symptom, the corn or the callus. Okay. So that's exactly what we're going to go ahead and do today. I'll post the before and the after pictures, not only of the clinical presentation, but also the x-rays where everyone can actually really see what we've done and the goal of the procedure. So I'd like everyone to stand by for the second part of the after, okay? Okay, everyone, so I just wanted to present the x-rays of the patient that we just performed the minimally invasive procedure on. We'll call this a double whammy. So this is the fifth toe. We have 1, 2, 3 bones. In this particular case, as everyone can clearly see, we had one bone spur, looks like a ram's horn, but we also had another one right there. So they were both causing, this one was causing pain and this one was causing that large interdigital corn callus, which was also not only creating pain, but was also creating the underlying, what we call interdigital intertrigo. So just like I mentioned before, my recommendation, we not only excised this little spur, we also excised this little spur and a little portion of the bone right here, at the level of what we call the head of the proximal phalanx. So I'd like to now, give me 1 second. So the bone spur that was here is now gone. The bone spur that was here is also gone, and just like I told everyone, we reduced this, we shaved this area a little bit. So 1, 2, 3, all of the bone spurs are gone. If anyone is wondering, well, what about this little bone spur here? If it ain't broke, we don't fix it. There's no pain there. Historically, this is sometimes these little bone spurs will cause something that we have discussed before, the Lister's corn. But you know, the procedure was a huge success. This patient is diabetic, so not only in respect to, you know, prevention of any future problems, which is, you know, extremely important, obviously also pain relief. So in respect to function, pain relief, and also prevention of any potential future problems that may place the toe at risk. Like always, www.jawspodiatry.com, Instagram, Dr. Toe Jam, Jaws Podiatry Facebook, and last but not least, our YouTube channel, Jaws Healthcare. Thank you for watching.